हेलो एंड वेलकम टू आरोग्य फिजियोटिप्स। आरोग्य फिजियोटिप्स में आपका बहुत बहुत स्वागत है। In today's videos, we'll be discussing certain exercises you can do if you're suffering from lymphedema in your upper body. Okay, lymphedema is a condition where fluid starts to build up in your arms or in your legs. This usually happens when there is any damage to the lymphatic drainage system that runs throughout your body. This drainage system collects fluid from the distal parts of the body and drains it to the internal parts. When there is any issue with the system, the distal parts of the body start to swell up and fluid starts to build up in the tissues. So this usually happens post certain procedures that are done on the body. Most commonly, this is seen after breast cancer surgery. So whenever there's a mastectomy or breast tissue removal surgery, the lymph nodes are also removed certain times. When this is done, it leads to swelling in the arms or swelling in the legs in some cases too. It can also be seen post radiation therapy that is done for cancer. The symptoms of lymphedema, the first most obvious symptom is going to be you will see swelling in your arms, in your hands, and in certain cases, even in the fingers, they will completely swell up. The next one would be difficulty in range of motion and difficulty in movements, of course, because of the swelling. There also might be some aching type of pain throughout the day, especially in the hands and in the forearm. You might also see some changes in the skin, trophic changes, like there might be tightening or hardening of the skin. You might also see some heaviness in this extremity, like lifting and performing movements. It might feel difficult and the limb might feel heavy, too much effort to do the movement. Also, another common symptom is if there's any jewelry that you wear, like bracelets or anything around your wrist, they might start to feel a little tighter due to accumulation of fluid. So, why is exercise important for lymphedema? So, with exercise, which involves really slow rhythmic movements, your muscle will act like a pump. The muscle will contract and relax, which will do a pumping action so that whatever fluid and swelling has built up in that area, the pump will make sure that it drains from the distal areas of the body towards the proximal area or the other lymph nodes. So, this will help in reducing the swelling, the pain, and the feeling of heaviness that you feel. So the precautions that you have to take before or while doing these exercises, the first one is always take clearance from your doctor or your surgeon, especially if you've had surgery very recently or if you had any complication during your surgery. Please ask them before you start any of these exercises. Second thing, avoid any kind of jerky movements, sudden movements, or lifting anything heavy. Avoid overexertion. Start with slow movements for a limited period of time, and eventually you can increase the time that you're doing it for. And stop these exercises if you feel unwell. By unwell, if you feel breathless, you feel dizzy, or if there's a sudden increase in swelling or pain, stop the exercises right then. And the most important thing is that if you're prescribed by your doctor to wear compression bandages, make sure you wear them even during the exercise. These bandages will act like a slight external compression, so that will also help in drainage of the lymphatic fluid. Starting with the first exercise, which is called diaphragmatic breathing or deep breathing. So the diaphragm is the muscle at the base of your ribs. So most of your lymph gets drained through the thoracic duct through the diaphragm. So it is important to keep stimulating your diaphragm so that it can act like a pump to drain the lymph. So you will keep one hand on your chest, one hand on your stomach. Apply a little bit of pressure with the hand which is on your upper stomach. Apply a little pressure. Try to breathe in through the nose against the pressure of this hand. So you will take a deep breath in, trying to push this hand out. And when you blow out through your mouth, slightly pull your navel in. So when you breathe in against the pressure of the hand. And when you blow out, pull your navel slightly in. Repeat this around 20 times, 2 times a day. This exercise is called shoulder roll. So it's a slight warm up. So you will keep your hands resting and you will rotate your shoulders in the clockwise direction slowly, around 10 to 15 times in the clockwise direction, and then the same way 10 to 15 times slowly in the anti-clockwise direction. This will make sure that the lymph is moving towards the cervical regions and getting drained. This exercise is called fist pumping. So for this you need a pillow. If your swelling is too much initially, you will start with your elbows bent, palms facing upwards. Start with slow movement of your fingers. Create a fist. Try to press with maximum force and open it up again. Close and open again. If your swelling has reduced over time, you can progress the exercise by bringing it in this position with your arms slightly elevated and your hands above the level of the heart, and you will continue doing the same fist pumps in this position. Third variation, when the swelling is minimal and your range of motion has improved, you can also lift your entire arm overhead and do the same fist pumping. This fist pumping has to be done at least 400 to 500 times in a day in sets of 20, multiple times in a day, starting with on the pillow, then hands above heart level, and then arms completely overhead 400 to 500 times. The next exercise is called elbow bends. So again, when there is a lot of swelling and pain in your arms, you can rest them on the pillow. You just have to simply bend at the elbow, try to touch your shoulder and come down again slowly. You will do around 10 to 20 repetitions of this in the morning and the evening. Once this feels comfortable and your swelling has reduced, you can also progress to keeping your hands in the air and doing the same elbow bending in the same number of repetitions twice a day to try and touch your shoulders. This exercise is called wrist circles. So again, the first way of doing it with too much swelling is to hang your wrists from the pillow and make small clockwise circles. Do it really slowly, around 20 to 30 clockwise circles, and same way 20 to 30 anti-clockwise circles. You can also do wrist up and down movements and wrist side to side movements. Once the swelling and pain have come down, you can progress to doing the same exercise with your arms elevated in front of you. Same number of repetitions of clockwise movements, anti-clockwise, up and down, and side to side. One is just simple neck movements. This is also for drainage of the lymph to the cervical lymph nodes. So you will just start with simple up and down neck movements 10 to 15 times, looking to the right and to the left 10 to 15 times, and bringing your ear to your shoulder on the right and on the left 10 to 15 times. Do the movements very slowly. The next exercise is called supination and pronation. So again, you can keep your hands rested. You have to face your palms up and then face them down with your elbows bent. Initially, you can start with your elbows bent. In this movement, you can do as fast as possible. It will act as a pump, draining the lymph fluid away. Once this becomes easy, you can also lift your arms up, keep your elbows straight, and rotate at the shoulder. So internally rotate it and externally rotate it. Again, this can be done as a fast movement. Do it around 20 to 30 times. The next exercise is called an elbow wing. So you will keep your hands behind your neck. You can interlock your fingers. Okay. Try to bring your elbows as close as possible and then try to pull them apart as much as possible. Again, pull them close and take them apart. You can do around 10 to 15 slow repetitions of this exercise. The next exercise is called a side bend. So there are two variations of this. When the swelling and pain is high, at that point you can keep your hands behind your neck and bend to the side slowly. Breathe in, coming up, blow out, bending to the side. You can do 10 repetitions on the left and 10 on the right. Once you're able to do this easily, you can progress to keeping your arm overhead and completely doing a side bend, maybe holding it for around 5 seconds and down. The same thing can be repeated on the other side. Hold for 5 seconds and down. Again 10 on the right and 10 on the left. If you like our videos, please like, share and subscribe to our channel. If there are any other topics you want us to cover, please leave that in the comment section below and witness your fitness with us.